Hi, I'm Dr. Kellogg. I'm the chair of the Southern Tier REMAC, and I'd like to talk today about some of the PPE considerations during the COVID-19 pandemic. As you guys know, this is a very infectious disease, and we want to do everything we can to be protecting ourselves, our partners, and our patients to minimize the spread of this disease. For starters, remember that essentially at this point in time, everybody we encounter might have COVID. So act accordingly. On every call, make sure at minimum you are wearing a mask, eye protection, and gloves. Start your assessment from at least 6 feet away. Once you've assessed the patient, decide what additional precautions you may need and act accordingly. And remember to minimize the number of providers on each call so you're minimizing the number of potential exposures. Over the next little bit, we're going to go through some of the procedures that we might be encountering that are especially high risk and the additional precautions and considerations we can take. It's also important to remember at the end of every call, decontaminate any equipment that was used and make sure that on your PCR, you're documenting who was involved in the call and not just that PPE was used, but what PPE was used to make sure that if there were any issues, they can be followed up on appropriately. Thank you all for everything you're doing.